Good morning, everybody. It is a beautiful Saturday morning. God has allowed us to all be here. It's your girl, Comedienne Joy, with Eat, Drink, and Ride. Joined with the beautiful, wonderful, amazing Dr. Mia Cowan of Me Bella Wellness. Good morning, Dr. Mia. How are you?
Good morning, good morning, good morning. Happy Saturday. So glad to be here. How you doing,
Yes.
Comedienne Joy?
Yes, I'm doing well. I'm doing well. Happy to be here doing another weekly wellness this morning. And we're going to be talking about some hormones. And it is so interesting because I think we got this new age group going on. They're trying to catch up with all the stuff that we're talking about because people are talking
Mhm.
about these hot flashes, these night sweats, stuff that be happening when them hormones be changing as we get younger. But we're here to help the people, aren't we, Dr. Mill?
We here to help the people live their best life. They don't have to live like that girl. I told you I went to the concert yesterday, right?
Yes, the Orchestra New York is up and down my timeline. I think it was last year I went. It was
Yeah.
amazing.
Yeah, because I wanted to go last year, but I didn't go. They said this was their fourth time being here, but this was like the biggest sold out crowd. But what I noticed was why these women think it's sexy to have these fans out here in these streets. Like, y'all, that is not sexy.
You mean like the net fans?
Yeah, like walking around with fans, having a fan like the whole, like we were in this cold area in the, you know how usually when you go in the Alabama theater, it's gonna be kind of cold, right?
Right.
So you like bring a big jacket and you layer a little bit. So after we got up and started dancing, it did warm up. But I saw so many women in the audience who could not have a good time because they had their fans. And even one of the ladies that got pulled on stage, girl, she took her fan up on the stage with her. She had the fan up there. And I'm like, and Marta was like, she must be hot. And I was like, she must need some hormones.
I guess so. That is weird. So, do you think it's the change in hormones, or do you think this is another crazy fad? Because there are so many crazy stuff that people do, like the baby hair for grown women. It's the root word. It's baby. You need adult hair, like brush your back.
Yeah, I don't think it's a fan. I think it's a trend in that if you hot, it's okay to have a fan. And so now they know the way to fix it. But I think that the women who are walking around with fans is because they're having hot flashes and they're super hot and they're miserable, so they can't do anything else. But I'm just here to tell everybody that is not sexy and it's something you can do about it. You don't need a fan to walk around with. There are hormonal balancing things that we can do so you don't need to walk around with a fan in the wintertime outside because you are super hot and having hot flashes.
Right, that is crazy because that's the beauty of going to Me Bella Wellness. You have an array of products from the pellets that I cannot stop talking about, enough about. You have creams, there are so many options. So let's hop into it.
Supplements, all the things.
So if you are walking around hot and you have embraced the notion that, oh, I'm menopausal, I'm supposed to be hot, I'm supposed to have night sweats. First of all, you're wrong and crazy that you have not been listening to us talk about it every week. So for those people, Dr. Mir, let's talk about people who may be candidates for
Okay.
the pellet because there's relief. And then there are other options that you offer at Me Bella Wellness.
Right. That's what's up. So now it's a difference in hot flashes during the day and night sweats at night. It's two different hormones.
Okay.
So with hot flashes during the day, that's more of an estrogen imbalance. For night sweats, like waking up with the wet bed, not being able to sleep because you're waking up because you're having so many sweats, that's more of a testosterone thing. So it's two different hormones actually involved. Now, some people can't take estrogen for the hot flashes during the day. So we'll talk about some other options out there to treat hot flashes outside of hormones. If you're one of those people that may have had breast cancer, have a genetic mutation for breast cancer, or have had a history of a blood clot or recent endometrial cancer or ovarian cancer, we don't want you doing estrogen. So we'll talk about some other things that you can do, but in general, plant-based bioidentical hormone therapy helps with hot flashes during the day, night sweats, sleep, sex drive, enjoyment of intercourse. And a lot of these things people just think are normal symptoms that you have as you age, and it's just a part of life. You know what I mean? The fatigue, the joint pain, the belly fat, the weight gain, the mood changes. So just being more irritable and fussy in general, everything gets on your nerves. the more depression and anxiety, or if you already have a mental health diagnosis, is worsening. As well as that adult ADD where you have the mind fog and you can't remember the word, you walk in the room, you can't remember why you walked in the room. All of those are signs of hormonal imbalance. Even cold hands and feet, hair shedding and thinning, that's a hormonal thing. The changes in your skin where you get more acne and you get more facial hair, that's hormonal imbalance. Also the dry, brittle skin, hair, and nails, that's hormonal imbalance. Sometimes it's estrogen and testosterone, but sometimes it's also thyroid disease, which is a hormone. So a lot of the symptoms that we just go ahead and push over and say, you know what, we just getting older, this is what happens. I want to tell everybody that, yes, you can get older, you can have these symptoms, but you don't have to live with them, because there are so many things that we can do to alleviate the symptoms, whether it's hormonal, whether it's medications, whether it's lifestyle change, whether it's supplements.
Okay, so I'm on the pellet. So let's talk about people who, I guess there are some people that's the pellet is good for, and then maybe there are some candidates that they may need a plan B.
Okay, so everybody can do the testosterone plant-based bioidentical pellet. There is no contraindication to doing that unless you don't need it because your levels are already up. So the average woman over 35, 40 are going to notice some of those symptoms I talked about, like the night sweats, the problems with sleep, the change in intimacy, the fatigue, the joint pain, the belly fat, the mood changes, the mind fog. Those tend to be the first symptoms that women start to notice in their mid-30s. And then they continue to worsen over time. In their mid-30s, they may notice them every now and then, not all the time, and maybe around their cycle. But those are the symptoms for testosterone imbalance, and everybody can take testosterone. People who have a history, women who have a history of breast cancer, they can take the testosterone and with anastrozole. That anastrozole could be in the pellet, or they could take it by mouth to make sure that they don't increase their estrogen levels by the testosterone converting over. So the main thing is that everybody can take testosterone replacement therapy safely, and that can be done in a plant-based bioidentical pellet form like we like, Comedienne Joy, or it can be done in a cream form. And I say, if you can't afford the pellet, you don't want to invest in the pellet, the cream is your next best option. And with the cream, as long as you are compliant and consistent and you follow the instructions that you are given with the cream, you can still get a better result and a complete resolution of your symptoms.
And with the cream, you have to rub that in, I think, like behind the knees, something like that, but it has to be done
so
every
it
day.
goes at the bend of the elbow, between the thighs, or behind the knees. And I call it into a compounding pharmacy. They mail or deliver it to you, and you use it. And we do it. It's a controlled substance, testosterone is. So you can use the cream, but you still come in. We check your blood work. We manage your dosing. Because anytime you're dealing with testosterone, the main thing is we don't want you to overdose. We want you to get just that right amount. And that's why you need somebody like me that's a hormone specialist, has been doing it for over 10 years and knows exactly how to manage the hormones so that it's safe, it's effective, and you get the benefits of symptom relief, but you also get the benefits of protection of the heart, the breast, the brain, and the bones. So testosterone also has those good health benefits. And estrogen, for those people who can safely take estrogen, they can do that in a pellet form or the cream form. And there are some synthetic options out there that some people have been using for a long time and they want to continue. That's not my recommendation. I like the plant-based bioidentical hormones because it does not increase the risk of blood clot, heart disease, or stroke, or breast cancer. So with some of the synthetic hormonal options, they showed that there was a slight increased risk of some of those problems. So with the plant-based bioidentical option that comes in the cream form or the pellet form, we know that it's going to protect all of those things and not increase your risk of negative outcomes. And that's why we prefer the plant-based bioidentical hormone therapy.
Now, when I was at your office, I think Tuesday, it was.
Yeah, I heard your mouth in there when I was working.
I wonder how you miss this loud voice.
I heard you, girl.
But I noticed there's a sign out front that also offers payment plans because you talked about being able to afford it. So let's talk about it, because the thing people can't afford is to be hot, miserable, and cranky.
Exactly. So we do have a lot of creative payment options. So one is Affirm. So we have a Repeat MD, which y'all should go and sign up. It should be on the website by now. If not, I'll make sure it's on there. But If you do Repeat MD, that's like our reward system and app. And it'll tell you all the sales that are going on. But every time you come in, you get rewards. And so by the rewards, you get different benefits. But you can pay for your things through this Repeat MD. And we have an affirm option where they will they will pay us. And then they'll work out some terms where you pay them monthly. So a lot of people get their pellets. And instead of them having to come out of pocket and, for that amount at one time, they'll do it with the affirm option. And that keeps them from having to spend a lot of money at one time. They can pay it over time with very reasonable interest rates. So we're excited about that. We also take care credit. We also have subscription plans that we have designed. So the subscription plans are for women who need 3 pellets a year. I think it's like $145 to $150 a month. And then for women who need 4 pellets a year, it's like around $200 a month or something like that. So that's for people who are getting them every 3 months. So it is a little bit more expensive to do the subscription plans. However, it's great for a lot of people's budgets, and they get to do the thing that helps them to feel their best so they can live their best lives. Because it's hard to like be happy and live your best life when you are having hot flashes and night sweats and you're tired and you're irritable and you're miserable. So we find a way to make sure that you can afford whatever treatment that you need through our alternative and creative payment options.
And I'm just gonna say it because I'm Joy the Comedienne. That's basically getting your health on layaway. Yeah, I remember them layaway plans. You just,
girl, yes.
Put $10 a week, 50 cents a day, whatever you need to do, but you won't be walking around with the fans.
You got your feel good on layaway at Me Bella.
Exactly. So is there an age that you should stop taking a pellet, like at 60?
No, 70, girl, 90? I am never stopping. I have some 75, 80-year-old ladies, especially one of my patients who travels all the time. She stops in and gets her pellets like maybe 2 to 3 times a year. Because as you get older, you may not need them quite as much because your metabolism slows down some. So whereas I need them right now every 12 weeks, at the 12-week mark, it's time for me to get my pellet if I want to feel good. As my patients get older, they notice that they can go more like 3.5 months, 4 months. And those women are usually in their 60s to 70s when they start noticing they don't need it as much. But I still have my real active women that are in their 60s to 70s, and they have to get them every 4 months. But I have some that can go 5 or 6 months as they continue to mature. So it really does depend on the age, the activity level, and how quickly you burn them.
Okay, so we've been talking about this amazing pellet. We didn't talk about how you get it.
So you call Me Bella, or you don't even have to call Me Bella. You can go on the website. You can go online. You can click on the link for I think schedule an appointment for our women's health services outside of gynecology. So it'll be 2 options. And when you click on that link, it'll take you straight to Calendly where you can get on the schedule, go ahead and pay for your consult. We can do your consult online. When I do the consult online, I can go ahead and get the lab work ordered because I know exactly what your symptoms and problems are. And then by the time you come into the office, we're actually putting the pellet in. But we go over everything on that actual consult. And the good girl, did I tell you my good news? I have a license now in Georgia. I just got my Georgia license so I can expand my reach because I have a lot of patients that come in from Atlanta and come in from the Georgia area for their pellets. I have patients who come all the way from New Jersey, New York, pretty much, all over the country because they want to feel good and they want to have somebody to do it who knows exactly what they're doing. So now I'll be expanding my reach to Georgia and I can legally talk to them on the phone and manage their health care. And then I'll be doing some pop-ups in Georgia to get those pellets done. So I'm really excited about expanding the reach of Me Bella Wellness Center.
Well, congratulations. And when you actually insert the pellet, it is basically a pain-free process. You feel the initial needle stick, but that's of the numbing. And then after that, you feel nothing.
Because at Me Bella, we let your lidocaine soak in. We don't just keep going if it's uncomfortable. But usually it doesn't take but 5 to 10 minutes for the lidocaine to really soak in and work. And we always can add a little bit of extra. So we make sure that it's a painless procedure. You may be a little sore in the area, for a week or two. But most people don't have any problems. They take their bandage off after 5 days and go back to their normal activities. When they first get it, they can't do the squats or the horseback riding or submerge in water, but they can shower. And then once that bandage is off, you go back to your normal activities. We tend to get blood work at 6 weeks, especially if it's your first pellet. And then we know how you respond. I can add if I need to add. And that way we know you're going to feel good for the full 3 to 4 months, depending on your age and your activity level.
So I'm thinking maybe 3 years ago, you took a training and you learned like a better way. I guess that's the right way to say it, how to do these pellet insertions. And honestly, since you've been doing it that way, I forget the thing is on. I feel no pain. And I take baths every day, but sometimes it may be 2 weeks later. That's when I notice the band-aid because it's falling off from the
Right,
shower.
because you weren't having any discomfort. You didn't have time to think about your pellet. You were too busy getting your eat, drink, and ride on.
Yeah, so it's like it's not there. I don't feel any pain, and that's it.
Right. And you get all the health benefits and you just feel so much better. Like I will say when I met that little old man who was a retired gynecologist on the airplane and we were at a GYN conference and he asked me, was I doing pellets? And I said no. And he told me that I was doing my patients a disservice by not offering this as an option for perimenopausal and menopausal women. And that my job was to go and research and find a pellet company that I could work with so I can offer it to my patients because he knew how much it would change their lives. So I'm really glad that I had that interaction because otherwise it may have taken me a long time to figure out that the pellet option is one of the best options for, controlling hormone levels as well as improving the health of women and men in their mid journey of life where they're transitioning and in the perimenopause and the menopause. But once you're in menopause, you never start back making those hormones on your own. So people are like, so how long do I have to be on this? I'm like, as long as you want to feel good. And for some people that becomes less frequent. For some people, they may not. Everybody doesn't need hormone balance. Some people go through menopause and don't have any negative symptoms. They're just fine. But I do think it makes a big difference in your overall health and your quality of life. And everybody can take them safely.
And you mentioned men going through hormones or their benefits.
Mm.
How will the man know, or a woman can recognize the symptoms in her man to say, yo, I think you need to go to Me Bella Wellness?
And get them hormones checked. So kind of like when I first started doing pellets, Joseph didn't need them. So I started doing them back in 2014. So that means he was 44 then. But about the time he was about 46, 47, I started noticing that he was like way more irritable and just like crabby, just like, just kind of sometimes just mean. Like, why are you so angry at life? And then he started gaining more weight in his belly. He started losing muscle mass, and he's a naturally muscular guy. And then a decrease in desire. Like they get to the point where they may have a decrease in desire and things may not function as well as it used to. They can also notice some men have night sweats. Some men have problems with sleep as well. They'll notice a change in their energy level. They'll notice more joint pain. They'll notice a decrease in just stamina in general, being able to do all those manly things that they used to do. So they have very similar symptoms, but it's only testosterone for men, obviously. And when we're working with men, we make sure that their testosterone does not convert to estrogen because estrogen does not go well for men. So we make sure that they get the testosterone pellets, get their levels up so that they can feel good and they get the same health benefits. It's cardio protection, brain protection, bone protection, and prostate protection for men.
Wow, and that's like another thing that we kind of see for men in our age group is that a number of them are dealing with early prostate cancer, and obviously it's better to get it early than late.
Right.
But they too need to be checked. But if this small thing that looks like a mechanical pencil lead can prevent you from having,
I like that description. I'm gonna use that.
yeah, literally that's what it looks like.
It does. It does.
Yeah, for all these amazing benefits, I don't understand why they wouldn't. But then also, if they don't know about it, which is why we do weekly wellness, to try to help people to be informed and to realize that just because your granddaddy was old and he just, rubbing grandmama kneecap and think that's all he can do, doesn't mean that that's the life that you have to have.
That's right. That's right. We are in 2025 and we have some great medical advances, including the pellets, which actually pellets were the first hormones in the United States, but they're plant-based bioidentical made from plant. And so Big Pharma came out with synthetic horse urine hormones instead that are prescription form and FDA approved. And so people started using those, but they just stopped the whole testosterone replacement for women, which I think negatively changed the game for women, because the testosterone alone does so much for quality of life and improvement of symptoms and aging. Yeah, I call it the anti-aging hormone. Okay. Marley just walked down here ready for the world, baby. I forgot what I was saying. She threw me off looking all cute and ready in the morning. But yeah,
you were talking about the pellets that the pharmacists made, the FDA.
Yeah. So a lot of big pharma they came out with these synthetic hormones made from horse urine and another synthetic progesterone. And that's when they did the big study, scared everybody away from hormones, but there are other options. And then they did find out that a lot of the negative side effects associated with the synthetic hormones were a little bit exaggerated in that study. So they were not even as bad as people thought at one time in the early 2000s. But what we do know is that we get great benefits. We feel great when we replace our hormones with the plant-based bioidentical hormone therapy. And it has the benefit of decreasing the risk of breast cancer and breast cancer recurrence. So definitely improves the quality of life for women and men.
Right. So you all need to go online right now. You just keep listening, but I'm pretty sure you have your phone. Go online and make your appointment at Me Bella Wellness. It's really easy, it's quick, it's fast. You're in, you're out. You just having a conversation with either Dr. Mia or her amazing staff, Brittany. We just chit chatting, and then I'm like, I'm not through telling you my story, and you
right, and But you said was more to the story. Let me finish.
Yes. And Brittany be like, girl, you tell me, finish everybody down the next appointment. Because it's such an easy, simple, quick process. Yes. And then you feel amazing. Like I said, I don't even know that bandage is back there. And it'd be 2 weeks later. I'm like, what is this? But I promise y'all, I bathed. It's just, I just don't feel it.
It's painless. It's painless.
Yes.
So we're super excited that we can offer this service to men and women in the Birmingham and area and surrounding areas. And I think it's well worth the investment with the health benefits and how well they feel. And then also, that has a huge effect on intimacy. So hormones affect everything. They affect weight management. They affect your quality of life. They affect your health, and they definitely affect intimacy. When you go through menopause or andropause for men, menopause for women, a lot of people will notice a huge change in their function for intimacy, physical intimacy specifically. And by balancing hormones, they can continue to have great physical intimacy or everlasting intimacy forever, ever. And that's a big part of wellness and, how people age.
So how quick should the man be able to notice that he can be at attention? Or the woman notice her man get that attention before? It may not be child. And then, should it be 2 days, 5 days, 6 weeks?
Right. So I would say for the hormones for men, they do help with a lot of the symptoms and the desire, but we have some wonderful intimacy solutions that can help with the attention component and the maintaining a normal hard erection. That may not be just testosterone. So if they're noticing problems with erections, testosterone may help with desire, but it's going to be that P-shot and P-wave and hydrogel, those procedures that really increase the blood flow and allow them to go back to maintaining normal erections. So it's 2 parts. So even for women, we treat the vaginal tissue with hormones. The hormones help with desire, but for function sensitivity, sometimes we may have to add on top of that some intimacy procedures like the O-shot, the O-wave, and the hydrogel, and that's going to increase lubrication, sensitivity, orgasms, the intensity, the frequency of orgasms, and just make their function so much better as they continue to mature in age. They can continue to operate like they did in their 20s and 30s as far as sexual function is concerned.
So is that after one treatment, or should they expect multiple treatments, like once, twice a year? How does that work?
It depends on the person and the severity of the decrease or decline in function. So for the average woman like me, I can get an O shot every 12 to 18 months. I can get a couple of O waves in between and continue to treat the vaginal tissue twice a week, and I'll be fine. For some men, though, it's different because it depends on how significant the dissatisfaction is. So for a man who's had their prostate removed, it may take several treatments and a couple of P shots as well as the hydrogel in order to get their function back. However, for a man who's just turning 50, starting to notice some changes, their erections aren't as hard as they used to be. They can't get them on demand like they used to. They just may need 6 treatments with the P wave as well as the P shot and the hydrogel once a year. Sometimes you can do the hydrogel 2 to 3 times a year, just depending on the severity. But I would say for the average man that comes in doing 1 P shot with hydrogel, 1 hydrogel alone, and maybe 6 P waves will maintain their healthy function as if they're in their 30s and 40s before they start noticing a change in their erections.
So hold on, back up. Something I heard you say. So you're saying if a man has had, I guess, prostate cancer, or had to get some treatments, that could affect them from being at attention.
Correct.
Oh.
Right. So over time, we can treat that. We've had a couple of men who had those issues, and they come in, they do their P waves regularly. So the waves help increase the blood flow, wake everything back up. And then they do the P shot, where we actually take their blood, spin it, take all the good stuff from the blood. We can add the hydrogel to it, which is similar to stem cell, but it's just like really good growth factors and all those things. And then we can put that back into the area, and that's going to have a significant improvement in their erections, the frequency, the on demand, the hardness, as well as their sensitivity and enjoyment of intercourse.
Interesting. So if they don't know that they may be having a prostate issue, that could be one of the reasons, because they're having a prostate.
Yeah, definitely. And that's what we always make sure, is that we are monitoring that PSA, that they are seeing their doctor once a year, getting their prostate exams, because we want to make sure that it's just caused by age, and a change in function, and not a real medical problem that needs to be treated and addressed, like prostate cancer or prostate hypertrophy, or whatever it may be. We want to make sure that we address that. And then once we ruled out anything, serious, we know we can do those treatments and improve their function. In a matter of 2 to 6 months, they can be back to their regular function.
Well, all right then. All of these amazing services right here in Birmingham and Georgia.
Yeah.
Me Bella Wellness, and you all could be like, don't stop, get it.
Right. Period. You could just have, everlasting intimacy, because at Me Bella, our goal is to help you live well, so you can age well, so you can always experience everlasting intimacy. But you got to do the first 2 things. You got to live a healthy lifestyle. You got to do your prevention and your screening. You got to maintain a healthy weight, all the things. And then that's living well. And then if you live well, it makes it easier for you to age. And then if you age well, you can just have everlasting intimacy forever, ever.
And also, that once you get the hormones going, it will also give you the energy to go and do the exercise.
Yeah.
This is up to you what you put in your mouth.
That's right.
It will make exercising a lot easier, and you want to go and do it.
Right. And it helps with your mood, so it decreases that emotional eating too. If you're not anxious and irritable in the afternoon, you don't tend to have all those cravings. So I think that it does help with the emotional eating, the energy, so you can exercise, and then you hold on to muscle with the testosterone, so you can actually see the result, improve your metabolism, and it definitely makes the weight management easier. So hormone balance helps with, feeling good, aging well, your intimacy, as well as your weight management and living your best life and your healthiest life.
So how do you? Because I heard you say earlier about I think retaining the muscle mass. So is it that you look more defined when you can see the muscle mass versus
Right.
a
You
whole bunch of
actually hold
fat?
on to muscle and you can build muscle again, because as your testosterone declines, that's when we start noticing weight gain, specifically in the belly. So with the testosterone, if you're exercising and doing your resistance training, you're going to notice more muscle definition. You're going to notice that your muscles, you know that your muscles are getting back to kind of where they were. You may not be like you were in your 20s, but you can definitely see muscle definition. And then you'll notice that your metabolism increases, and it's much easier to lose the weight and to keep the weight off because your metabolism has increased.
Awesome, awesome, awesome. This has been another great, informative show. We want you to live your best, amazing life ever. And it starts when you reach out to Dr. Mia and then you follow her plan. Also, you have to exercise, think about what you're putting in your mouth,
Right.
all
And
that
come
good
to these,
stuff.
yeah, come do these weight management programs. We got some great weight management programs for our women and men have been very successful. I have women coming back and restarting that lost 50 pounds last year and they have 20, 30 more pounds that they want to get off. I have some women who over the last couple of years have lost, 80 to 100 pounds, and they're coming back because they notice that they gained 5 or 10 pounds and they want to make sure that they keep that weight off that they work so hard to lose. And there's some women who lost 15, 20 pounds and they reached their goal. So a lot of different people who address it in different ways. And that's what I like about our weight management programs is we customize a plan that works for you so that you can live your best life and figure out the lifestyle that works for you to lose the weight and keep it off. We tired of these yo-yo diets going up and down, being able to fit in this set of clothes this month, and then 2 months later, you can't fit in them because your weight just all over the place. We teach you how to make the right behavior modifications so that you can live your best life and keep the weight off.
Yeah, and I've learned for me personally, it's about making that decision to say, I'm not going to eat this, or I'm not going to eat this right now, or I'm not going to
Mhm.
eat the biscuit with the fried chicken and the order of fries. You're going to have to do a little give and take.
That's
Oh,
right.
what time is this? Even though last night I did have some popcorn, but, I used my olive oil.
Mhm.
However, it still go back to making choices.
And it could have been some potato chips or some cheese nachos. So popcorn was definitely a better option than some things.
Yeah, because I couldn't find them chips. So I said, I'm going to make me some popcorn cooked in my olive oil over here. And then
The
I went to bed.
the chips was gone, wasn't it?
Yeah, I guess I ate them on another night that I got weak. But I try to balance it out. I got my water here today. So I try to get my 3 things filled in of water. And I've been exercising regularly. So I'm going to the gym when I leave here. Because our good friend Stephanie told me, Stephanie Handel, she said,
Oh,
Joy,
Steph.
summer bodies are made in the winter. So it's the winter time. And I got some trips planned. So I'm planning on buzzing out here with
Yes, I
this
know you
New
do
Bella
have some
Wellness body.
trips planned. Tell me what's going on with Comedienne, Joy, and Eat, Drink, and Ride, and all the wonderful travel options that you have.
Yes, yes. So as far as the travel portion, I'm super excited that next month I'm going to Venice. So it will be my first trip there. So this should be an amazing
Oh,
trip because they don't have cars. So they
oh,
only have boats and walk, and you walk. So I'm excited that I'll be exercising while I'm touring this beautiful country. Then after that, I have anybody can come, but I just did it as a solo trip going to Colombia because people always say, I want a room by myself. Well, I found an amazing deal, room and flight from Birmingham. It is less than $2,000. So last night I repriced it. It was 1902. You can be in a room by yourself at an all-inclusive resort for a week. I think it's the 17th through the 21st. That is on the website. I think it's pronounced Cargentina, Colombia. So you're going to be safe. It's a beach. We got all the stuff. Joy's going to be there because everybody, when we get off the plane, they're going to kidnap me. They don't want you. That's not how stuff works.
Say that
I'm not going to recommend you to go somewhere that's crazy. And then for the 4th of July, we can go to Jamaica because that's all y'all feel like y'all want to do is go to the same place. Joy's about going somewhere new. And then in December, I have a trip. Even though I may say girls trip, it don't matter. Anybody who want to go to my favorite place, and that's Antigua. So, and I'm also doing Virgin Voyage in April. So I'm excited about that.
You just
so
really living your best life.
Yes, so it'll be 12 days. Now, what I love about Virgin Voyage is it's an adults-only cruise line. No children, unless they're over 18. So you got to worry about them kids taking over the pool like I keep hearing happening at Carnival. So, yeah, if you all are interested in going anywhere I talked about or have your own travel plans, of course, let your girl Joy take care of that for you. And then I have the party bus for those who say, Joy, I can't afford $2,000, but I got $120. Get on the party bus. And we'll go to 5 amazing local restaurants and we'll have a great time with our eating and drinking. Then we'll roll out my wine shop tours because there's some people who want to do a little day drinking.
Yeah.
So Valentine's Day weekend, we're going to go to some wine shops. We're going to taste some new wine because we ain't going to keep drinking no Stella Rosa. There's more to life than Stella Rosa. I love them, but come on, let's elevate the palate. So we're going to do that with some brunch. So y'all can get on it. We still going to keep it tight because you're going to exercise getting on and off the bus. So when you get on the scale, let me Bella Wellness, she won't be like, look here, you can't be hanging with Joy too much.
Right. No, they're going to get you in trouble.
Exactly. So what do you have planned this weekend, Dr. Mia?
Let's see. Marley. That's it. I'm doing Founders Day with my Jack and Gia group. And I think I got a meeting tomorrow. But nothing. I'm relaxing. Got a couple of little meetings. And yeah, last night was my big night out. You know, I can't do too much in one weekend these days because I like to preserve my energy.
Oh my gosh. Talk about it. So when they said we may get some snow this week, I'm like, bring it.
I do not want them to bring the snow, honey. That does not help me, Bella. Okay.
Well, you know you're right.
I do not like their appointments canceled.
And you are absolutely right about that because as entrepreneurs, we need to keep our doors open. And the only reason I was being selfish because I'm normally not doing that work during the weekday. I'm doing other work. But yes, I do understand. And maybe on next time we have a weekly wellness, we got to talk about rest because women think we got to be superheroes. You better slow down.
And you can't lose weight without rest. You know, without sleep, you cannot lose weight. So sleep is very important. So we're going to be talking about that. Y'all get ready for the big intimacy event, March 15th here in Birmingham. It's going to be amazing. More info to come. So I have the landing page. You'll be able to go ahead and get your tickets. You'll get the early bird tickets. That's going to be all flowing out this week. So y'all get ready for the intimacy event we've been talking about. We did one back in 2019. It was amazing. COVID shut it all down. But we are back with the Foreplay Ageless Vitality event presented by Mia Cowan, MD, at Me Bella Wellness Center. So it won't be at Me Bella Wellness Center. It's going to be somewhere real nice. So I see y'all March 15th. Y'all listen on out for that. And then I see y'all tomorrow. Ageless Intimacy with Dr. Mia and Joseph. I forgot what we're talking about, but we're going to be on here tomorrow night at 8:30. So y'all join us. Bring your husbands. Y'all don't want to tell your husbands they need some hormonal help and that they need some intimacy help. Let Joseph tell them how they need it. And y'all don't have to say anything. Just let them watch. All right.
I'll do it for them. It's going when the conversation starts, I'm like, look at here. That's how I'm going to do every conversation.
Right.
Say, look here, bro.
Right. It's not, you know, with me and you can't tell them it's got to be their idea. So you just let them watch and you don't say anything. Let us talk. And then they may be like, I have noticed. You know what I mean? So invite your husbands. Joseph will be there and he'll be talking from the male perspective. And of course, I'll be talking from all perspectives because this is what I do.
So tell your husband y'all gonna have a romantic snacks, a dinner, a drink at 8:30 tomorrow night.
8:30 tomorrow night. Y'all get your little nightcap and we're gonna have some good conversations about health, intimacy, wellness, and all the things relationship. So see y'all.
Awesome.
Thank you, Comedienne Joy. Y'all go on and get those eat, drink, and ride tickets. She told y'all she got something for you for Valentine's Day. It's coming up. I hope y'all making plans. I am pre-planned. I have our whole Valentine's Day because you know Joseph used to go to All Star. So we never really did a lot of Valentine's Day. So he's not going to All-Star this week. So I made sure this year. So gonna make sure we have a good Valentine's Day. We're gonna be down there at the Harambe. They got a live event, and we're gonna have a good dinner before.
That sounds like a plan. She got that belly, so she'll be ready.
The entertainer. He gonna sing us some love songs.
All right now.
All right, girl. So you go have a wonderful weekend. Y'all go have a wonderful weekend. Go live well, age well, and experience everlasting
intimacy.
Bye.
Bye.